Good evening, cat lovers. This is Saki Pathan, President Feline Club of India. Today we are here to discuss one of the most persistent problem, which is chronic diarrhea. If you ask any of the cat owners that the three tedious or nagging problems that they face, I think chronic diarrhea will make it to the list. So to discuss more about this particular topic, we have Dr. Pawan Kumar with us. Dr. Pawan Kumar from Cessna. Good evening, doctor.
Good evening to you, Sakib. Thank you.
And thanks a lot from the whole cat fraternity and from Feline Club of India for accepting our invitation and talking about this one of the most uh, important aspects in a cat owner's life, because it's about management, and then we'll be talking about prevention and cure. So doctor, if you can please let us know what are we going to discuss today.
Okay, thank you so much, Sakib, for inviting in this webinar or this event. Actually, now today we are going to discuss the chronic diarrhea in feline or in cats. The reason it becomes very important because many pet owner or cat owner specifically, though their cat is having constantly persistent diarrhea and they don't even know that it's actually diarrhea, because cat otherwise is behaving as a normal cat because they're eating and everything is going. But this is a very serious health hazard which can be caused because of so many factors. So today we are going to discuss about that in detail. So
Great.
yeah, sorry.
If you can please without going away, without I'm too excited, and without wasting any much of time, if you can go to the presentation, let us know that how we can decipher this disease, if I'm not wrong.
We'll do that. Yeah. So thank you so much. So I'll start my presentations. Okay. Yes. Yeah, I hope you're all able to see that. Is that correct, Saki?
Yes.
Okay. So today the topic of our presentation is chronic diarrhea in cats, and this becomes absolutely important because this is a kind of conditions which keep happening in the young, middle age, and even in the senior cat. And it becomes important because at different age there are different reasons for the chronic diarrhea. And this is eventually, I've seen in the practice, it's quite a common problems, and which many cat owners and pet parents, they don't even know that it is such a serious issue actually. Now, something is, it becomes very important for the pet parents that what is diarrhea, that is to understand. In commonly, we know that when there is a loose motion, so that's a layman language, we use that word diarrhea. But the very important thing, the diarrhea is basically, it's like not a properly formed bowel movement. And normally it is basically increased amount as well as the frequency of bowel movement. It is a result of faster movement of fecal material through the intestines combined with decreased absorption of water and nutrient and electrolytes. So in diarrhea, what basically, because intestine, the whole function of our digestive system is to take the nutrient and food and diet and other things, so and disintegrate into very small particles which can be absorbed and then make it in absorbable way and then absorb that actually. So stomach plays a very important role for digestion, and then comes the small intestine. Small intestine has different parts, and then comes the large intestine. So where the maximum digestion takes place is stomach and intestine. So if the absorption doesn't happen properly for whatever reasons, that whether it's a water is there which is not getting absorbed, and if it is the food which is not getting absorbed, indirectly what happens is start passing out through the intestinal channel, and it's indirectly we call it is diarrhea. One thing which is absolutely and very, very important, the diarrhea is a symptom. It is not a disease. Like we have fever, like we have pain. So pain or fever, these are symptoms. Same thing is like diarrhea or vomiting, these are symptoms. So it is very important that we should find out what is causing the diarrhea, because the cause can vary from age to age, from the different agents and cause and other factors can lead to the diarrhea. So that is very important, that what is causing it, to find out that part. Now, in common practice and in general, diarrhea is of two types. So one we call it is small intestinal diarrhea, or it is large intestinal diarrhea. So I'm taking it more from the feline perspective. So when we talk about the small intestinal diarrhea, it's basically so I think probably you can see in the presentation. So there is anatomy is shown, and in that, so this is the area which we talk about the intestine. So the area which join between the stomach and to the mid intestine, that is small intestine, because this is a very, very important part of alimentary tract where maximum digestion, absorption, and assimilation happens. So any factor which is causing the inflammations or cause of diarrhea in the small intestine, so that is known as small intestinal diarrhea. And if anything is happening after the cecum, there is another part of intestine, we call it as cecum. After that, if diarrhea is happening from colon to rectum or anus, so that is known as large intestinal diarrhea. Why this classification becomes important for the owners particularly? Because if it is a small intestinal diarrhea, then it is a very serious complaint, because animal will lose health and conditions and everything very fast. And if it is a large intestinal diarrhea, this is also a serious complaint, but it will be very slow actually, because large intestine doesn't play so much role in the nutritional absorption and other thing, except the water and electrolyte. It plays very important role, because small intestine is very important for water, for the nutrient, for the digestions and all those things. The large intestine play more role only for water absorptions. So this is where the large intestine diarrhea becomes comparatively not that serious as compared to small intestinal diarrhea. It has been seen in small intestinal diarrhea, like which is caused because of stomach or duodenum or jejunum. This is a part of intestine which I'm talking about. So what happens when there is a constant and persistent chronic diarrhea? One thing which I forgot to tell before. So when we talk about the chronic diarrhea, any diarrhea which is persisting from more than 3 weeks is known as chronic diarrhea. And any diarrhea which is just started like within 1 or 2 days, so that's an acute diarrhea. So that's how the classifications goes for that. So chronic diarrhea which is persisting more than few weeks, and that basically is a chronic diarrhea which is not immediately fatal, but yes, it can become fatal in future. Now, I was talking about the small intestinal diarrhea. In the small intestinal diarrhea, the things which can lead to, one is when the animal has a persistent chronic small intestinal diarrhea, then there is a decreased fluid and electrolyte absorption will go down drastically. At the same time, the nutrients like fat, carbohydrate, protein, all those will not get absorbed actually that, or the absorption will go down. At the same time, there will be much more fluid, which basically the fluid which gets secreted from the small intestine, which will be along with the electrolyte will get secreted actually. So there'll be one way it is not getting absorbed, and second there is a getting secretions also. So there's a quite a bit of loss of content and electrolyte happens. In large intestine diarrhea, normally we don't lose carbohydrate, fat, and other thing in the form of absorption. So more we lose either fluid or electrolyte, or there's a secretion of fluid and electrolyte which happens more. So these are the two basic differences in small intestinal diarrhea and large intestinal diarrhea. Now, it becomes very important, as I mentioned in the first time, like diarrhea is a symptom. So what are the factors which can lead to diarrhea or loose motions, which commonly we use the word? So there are quite a bit of factors are there, and it becomes very important for the pet parents or for the cat parents specifically, because we are talking about cat in general today. So there are different factors when we clinically see the diarrhea can be because of parasites, as you can many pet parents know that, so we do very regularly that deworming and other things which we keep talking about. So there are many worms like or many parasites are there, like giardiasis, which is quite common even in human also. And then apart from that, Toxocara felis and other there are parasites are there, roundworm or hookworm, or those which also basically from the food or from the environment which goes into the small intestines and basically stay there and cause lots of issues there, and then it can lead to diarrhea. So those will not cause acute diarrhea. The reason because they'll just keep slowly keep eating the nutrition, keep eating the minerals and everything, and keep making animal very weak slowly, and they'll be just having persistent inflammation in the intestine, and that will lead to deterioration of the health. So this is one cause, because that can be parasite. There's another common cause which becomes very important for the cat parents, that is dietary intolerance and dietary allergies. I think we hear quite a bit of about that, and commonly the people keep talking about gluten allergy and all those, and in human as well. Dietary intolerance is basically, this comes from one condition, we call it is atopic conditions, or it is adverse food reactions. Means it is not that you are giving a bad food to a particular cat, it is basically that cat is not tolerating one particular kind of protein. It has been seen that mostly this kind of food related allergy happens to the protein, not to the carbohydrate, because carbohydrate molecule size is too small to create allergy. Similarly, the fat, so chances that they get allergy because of fat is also comparatively very less. The reason being the fat molecule size is too big to create an allergy. But normally we find allergy to the amino acid or protein. Now protein, it is not that if any cat is having a food allergy or dietary allergy, that it's indirectly telling that the one particular kind of protein which is animal is not able to tolerate, and bodies and his or her immune system is reacting to that, and it is considering as a foreign material, and then animal reacts to that, and it lead to inflammation in that area, and of course it causes diarrhea and secretion of lots of electrolyte and fluid and other things. So indirectly we keep giving the same kind of food and we keep finding lots of cause, means why that animal we're given commonly that people keep giving metronidazole or flagyl and those kind of things, but still they find that animal diarrhea is not improving. But food can be very, very important cause. And the only thing how you can improve that is by dietary elimination test. Nowadays there are many diets available which are like hypoallergenic or analergenic diet actually, which they have made the food or protein in such a way that actually that whatever allergy causing power of the food has been reduced to a drastic level, because they have a novel proteins are used in those, and plus they are specifically allergen free foods also available commercially which can be done. Apart from that, if they are not having access to this kind of food, other thing which can be used is diet elimination test. So what we advise in that means try giving one kind of protein for 6 weeks and then see when animal is not having diarrhea, so then it means other protein was causing the allergy. So this is how you can do the diet elimination test, and you can find out through that as well. There's another very common chronic diarrhea reason comes and cause comes is inflammatory bowel disease. I think if some people they are having cat and they must have heard this word very commonly, that is inflammatory bowel disease. First thing is, what is inflammatory bowel disease? So what happens in this one? So small intestine, and sometimes could be the where stomach and intestine is joining, or maybe where the small intestine and large intestine is joining. So the mucous membrane or wall of that start reacting to such a level that there is always some degree of inflammation stays. And when there is inflammation, there is always pain, swelling, absorption goes down, digestion goes down, secretion increases, and which lead to always a pain, discomfort, lack of appetite, and all those kind of things keep happening. And you do all kind of treatment, but animal doesn't respond. So this is body's its own reaction to some kind of trigger factor which has led to the inflammation, and the inflammation just keep persisting, and that animal doesn't recover at all. So this is a chronic inflammatory conditions of intestine. Normally there is always a primary cause for this problem. Like primary cause could be food, sometime intolerance, sometime if there is some cat which has recovered from feline parvovirus or any other calcivirus or anything, so sometime indirectly they can develop these conditions, and which we keep treating it, and we think it's a feline parvovirus or something, but it needs an entirely different line of treatment. The diagnosis and everything is entirely different from the normal diarrhea. Then there's another condition which is not so common, but it's difficult to diagnose. We call it is hypereosinophilic syndrome. So this is again, there is a different kind of allergens which cause it. And in the intestine, there are certain chemicals or certain cells, we call it as eosinophil, they start accumulating a lot. And because of that, this diarrhea happens. And it need to be diagnosed only by biopsy or by cytological examination. There's another quite an important factor which I like to talk to the pet parents. See, if the diarrhea is happening in early age, then mostly the factors are infectious or diet related. If the diarrhea or the chronic diarrhea is there in the later stage of life, like after 6 years or 5 years of life, then neoplasia can be very important factor, because neoplasia basically is cancer or tumor of intestine or alimentary tract or any other organs in the abdomen, because cancer also can cause diarrhea actually, like lymphoma is there in the intestine, or sometimes squamous cell carcinoma, adenocarcinoma. These are kind of conditions are there which can lead to, and it has been seen rectum, particularly in cats, so they can have rectal carcinoma, and which can just keep having diarrhea constantly, and animal keep losing little amount of blood also constantly. and we think sometimes it's infection or something, but it is quite important to, in case this kind of thing is happening in a senior cat after 6 years of age. So diarrhea should not be taken lightly. It should be investigated as soon as possible. And then other cause for diarrhea, which is, I think you must have heard about, infectious. Like in cat as compared to dogs, it has been seen that viral infections are comparatively more, which has been seen that in cats comparatively have more viral infection than the dogs, because dog gets more bacterial infection, like whether it's a salmonella or whether it's a leptospirosis or those kind of things, while the cat get more of viral infections, because genetically and by species wise they are more prone for viral infection. And infectious disease also can lead to lots of this kind of chronic diarrhea. One of them is FELV, which we normally give vaccinations for that. That is feline leukemia virus, which leads to cancer of lymph nodes and lymphatic system. So that's one cause of chronic diarrhea, and animal will be having diarrhea and will keep searching the reason, but that's one factor. There is another factor which is FIV, which is feline immunodeficiency virus, which is also can cause the diarrhea. And there's another is FIP. So FIP is also another factor which can lead to diarrhea. Actually, FIP is feline infectious peritonitis, which is quite a common and serious problem nowadays, and we're finding lots of cats are having FIP actually, and which is leading to diarrhea. And then feline parvovirus, and which is, I think, mostly in young age, and we found quite a bit of cats are involved with FPV actually, that, and they also lead to chronic diarrhea. Then there are other factors which I just like to talk about. Is another one conditions we call it is chronic small intestinal bacterial overgrowths. This is one thing which is comparatively rare in cat, but it happens more with the German Shepherd dog. But yes, it has been seen in cat also. So what happens in this one? There is some animals specifically they became prone for certain bacteria. Normally, it has been seen that whether it's a human, dog, or cat, their intestinal tract has bacteria, and those bacteria are normally many bacteria which are beneficials, which help us for the vitamin B complex and other things formation. But there are some bacteria which we call it opportunistic bacteria. Those bacteria stays whenever there is a stressful conditions or any other secondary disease. During those conditions, those opportunistic bacteria start growing, and it brings quite a bit of diarrhea. So this is basically so in certain conditions, these kind of bacteria start growing and always keep a chronic diarrhea in a cat. There's another factor which is idiopathic. Idiopathic, kind of the meaning for the idiopathic is something with the cause is very difficult to know, and it is only to that particular cat. No one knows the reason why it happens, but it just starts actually the diarrhea, and it is mostly particular to that specific cat only. So normally these sometimes are autoimmune related as well actually. There is another factor in cat. There is a very important organ, we call it is pancreas, and pancreas is a very important organ to secrete certain chemicals, certain enzymes which help for the digestion. And pancreas is a very, very important and vital organ, because all the digestion of carbohydrate, fat, and other things which is happening is all mostly contributed by pancreas. But in certain conditions, pancreas is not functional properly, where it doesn't secrete those enzymes, doesn't manufacture those enzymes, and as a result, the exocrine part of pancreas is not giving enough enzymes. So as a result, there is no digestion, there is no absorption. So what happens? Animals start losing lots of undigested food, which becomes diarrhea indirectly, and animals start losing protein, carbohydrate, everything, and start becoming very weak and dull and lead to really serious complications. Then comes about another problems, another cause for the diarrhea, which I'm just kind of bringing in notice, is partial obstruction. Many young cat, and they are habitual of keep eating their fur, and sometime there are animals or sometimes cat have eaten some thread or something which get obstructed into the intestine, because thread can, if it comes out without any problem, then that's okay, but sometimes if it gets stuck somewhere, then it becomes a really very serious problem. It act like a knife inside and start cutting the intestine. And sometimes intestine, there's a condition we call it is intussusception, where one portion of intestine get telescoped into the another portion of intestine. Because of that, it get obstructed actually, that, and animal little bit of motions will be keep coming, but indirectly animal will have diarrhea and sometimes blood loss and nutrition is another thing. It's a surgical problem. It should be diagnosed as soon as possible and should be treated surgically. There is one hormonal conditions, we call it is hyperthyroidism, which is comparatively it has been seen much more prevalent in cat and particularly the senior cats. We call it is hyperthyroidism. There is a very important gland which is thyroid gland in cat. Sometimes the gland becomes tumorous or hyperactive and starts secreting lots of thyroid hormone, and because of that hormonal imbalance, that animal can start having loose motion. There is another condition, we call it is protein losing enteropathy. This is also one specific condition in the dogs and cats where they start losing protein. They don't digest the protein and they don't absorb the protein. They start losing the protein. So, and because of that, intestine start losing quite a bit of protein actually, and this normally accompanied always by diarrhea. There is another thing which is in cat, and it has been seen in all the age. It's a very painful disease, and the biggest issue happens in human or in dogs. Pancreatitis is very, very painful condition. It's like a burning situation in the abdomen. But problem what happens with the cat don't show the symptom like vomiting and diarrhea sometime, and sometimes very little diarrhea they show, but they have pancreatitis, inflammation of pancreas. And this can be because of many reasons. Sometimes diet is there, sometimes tumor is there, sometimes chemicals are there or poison is there. These are the many factors which can lead to pancreatitis, but it's a very painful and sometimes it's a fatal disease, and it can lead to chronic diarrhea and sometimes even a shock and death as well. So these are the different factors which I'm discussing with all of you, and but there are lots of other factors are there, but these are the most common. Why it becomes important for the pet parents that diarrhea should not be just taken as a diarrhea, because it has a factorial cause actually which can lead to this. It can be hormone, infections, tumor, cancer, obstruction, and autoimmune disease and all those kind of things. So it becomes very important that you should be a little aware about this kind of diarrhea and what is to be done. Depending upon that, I think your veterinarian can help you for that part. The next thing, now there's another important part comes when you are trying to diagnose the diarrhea and chronic diarrhea, why it is happening. Now it may not help you that why collecting history is so important, but these are the things you should be knowing about your cat when you're talking to a veterinarian, because these informations are something like, because diagnosing a chronic diarrhea is something like it's like a very tricky job, because you need to give some clues so that the veterinarian can find out the cause for that. So age becomes very important. When this pet has acquired this diarrhea, whether it's in young age or whether it's in middle age or in the senior age, as I discussed before, that in senior pets, diarrhea is related with more hormonal issues or cancer originated or some organ failure related issues. Then it is quite important that you should tell about the vaccinations, dietary history, any dietary changes has been done, or environmental conditions, like in what kind of conditions animal is staying. Like you probably have maybe multiple cats are there, or they stay with the dog, or they stay indoor, outdoor kind of situation. So this will help to diagnose what are the factors which can cause the chronic diarrhea. Then apart from that, recent medication history is very important. Very commonly for fever, we take one tablet which is crocin or paracetamol, which is very, very common. But I think a cat owner, it's very important for them to know that paracetamol is like a poison for the cat, because the enzyme which is required to metabolize this paracetamol, because this has something like the actual ingredient in paracetamol is acetaminophen, and human can digest it, like human can metabolize it up to great extent. Dog can metabolize it, but cat cannot metabolize. So it acts like a poison. It can lead to liver failure, kidney failure, and it's like a instant death actually. So and at the same time, this paracetamol can cause diarrhea also. So this becomes very important that we should know if you are giving any kind of medications, or you have changed any medications, or you without discussing with the veterinarian you have started any kind of medication. So that history becomes absolutely important. There's another thing comes about is pet has been, or a cat has been exposed to any kind of stress, like in so many new cats has come, Diwali crackers, or any this kind of situation, or you have done the relocations, or you have kind of transferred from one place to another place, or there is a family's routine has been changed, or means any kind of triggering factor for the diarrhea need to be identified. So these are very important inputs which comes from the client. The whole idea comes here, we basically trying to differentiate whether it's a small intestinal diarrhea because that has different cause, or it is a large intestinal diarrhea because that has different cause. And both are important to diagnose because small intestinal diarrhea need to be treated and diagnosed as soon as possible. So that's how history means which the owner gives the information to a veterinarian. And of course, it's important for you also to know these factors. The next thing becomes very important. When a veterinarian is checking a patient for a diarrhea and a chronic diarrhea is there, so how he find out what are the factors, kind of leading. So what we do it actually that as a veterinarian, so which becomes important is physical exam. First thing which we check whether whatever diarrhea is there is animal is losing hydration, means whether water content of the body is losing. So that we check by, I think this photo shows that, skin trigger test. We do it like we pull the skin and see how fast the skin goes back to the normal. So that's how we know. And then other factors are there, whether by doing that we can come to know whether animal is getting dehydrated with the diarrhea, because animal is losing quite a bit of electrolyte and water loss is happening, but is it leading to dehydration? So that's something need to be find out. Then another thing is, because when the animal is having diarrhea, so it's indirectly lead to quite a bit of electrolyte loss, protein loss, carbohydrate loss. So animal becomes very depressed, weak, and lethargy. So they slowly they start becoming weaker actually. Then emaciations, it's quite important, and this is more important in small intestinal diarrhea because animals start losing quite a bit of protein, carbohydrate, and fat and other things. So it start losing the weight. So indirectly what happens in cat, if they're not getting enough nutrition, then cat body start utilizing its own protein, its own carbohydrate and everything for sustenance and for the survival. So indirectly animals start losing quite a bit of weight. Now other thing is dull hair coat. This is also one very important sign that animal is having a chronic diarrhea, and actually it is losing quite a bit of weight and protein through that, because normally hair is made of protein, and when animal is having chronic diarrhea they lose quite a bit of protein. So indirectly there is a deficiency of protein, and that coat or hair coat start becoming very dull and basically very rough coat it start becoming. There's another sign we notice during the physical exam in chronic diarrhea is fever. If animal is having fever along with the chronic diarrhea, it can be because of inflammation, it can be because of infection, or it can be because of cancer as well. Then edema. This happens in particular in those kind of conditions where the diarrhea is caused because of liver failure or because of cardiac failure, because those conditions also can lead to chronic diarrhea. And along with that, if you find there's edema, means water retention in the legs or in the abdomen or something, so then we find, because these conditions are mostly associated with liver failure or kidney failure, so we probably have to investigate further. Then pale mucous membrane means animal is becoming anemic. Like as we discussed before, many times the diarrhea is accompanied by blood, and like in cancer or in liver failure or those, so animals start losing quite a bit of blood actually, and little blood keep going, and animals doesn't manufacture so much RBCs and other thing, indirectly lead to anemia. So which we check by mucous membrane, how is the color, whether it's a pink and bright and hydrated, or it is becoming slowly pale and dull. So this we find, and apart from that, it becomes important that we do a physical exam. We check the abdomen, whether we are able to see any organ enlargement or growth or mass, because that helps to diagnose any kind of tumor or anything. Then rectal exam is also very important, because many times diarrhea can be, because this whole everything what we are doing is to find out why the diarrhea is there, cause of diarrhea actually. So means we are trying to find out what is causing the diarrhea. So, and we are reached to the diagnosis so that you can be guided better and that can be treated better. The next comes about the rectal exam. In many animals, the diarrhea is because of rectal regions. It can be sometimes anal sacculitis, it can be rectal tumors, it can be sometimes hernia. So those also can cause that, or there are injuries are there which can be caused because of foreign body, or sometimes a hairball can cause those injuries. So where we check the rectal examination also becomes important. So these are the different physical exam kind of things which we find out, and we try to reach to the diagnosis. Now, as for the diagnosis is concerned, these sorry, I'm extremely sorry for this slide, but it becomes important because we're talking about the diarrhea. So there are the fecal examination is a very, very important things for diarrhea, because that can give an idea about the parasites. Sometimes it can get an idea about the pancreatitis, or about the digestive system, or about the absorption of different nutrients, so it can give that. So I think the different kind of consistency has been shown, but it becomes very important for a cat parent to know that, because this shows too hard, and this also shows like it's too hard, so this shows the sign of dehydration. This probably could be the ideal stage actually, and as it is going further, it is becoming more and more loose and pasty and other things. So these all is leading to seriousness, and this is getting mixed with the blood as well. So this is typically show the small intestinal diarrhea, and this could be large intestinal diarrhea. So this is how basically kind of the stool consistency and all those becomes very important. To diagnose diarrhea, means this kind of chronic diarrhea, we do fecal exam, blood test to find out whether it's infectious or anemia or another things. Biochemistry we do to find out whether it is associated with any kind of organ failure like kidney, liver, or those or pancreas. Then we do the urine test also. If animal is having any associated problem, we do for that part. Then there are some advanced specific diagnostics are there, like for example x-rays there we do for foreign body, or ultrasonography for tumor or any organ enlargement. Fecal culture, because there are many diarrhea which happens because of Clostridium pharyngeis and other things, these kind of bacteria which cause chronic diarrhea, and very difficult to diagnose, but we can do fecal culture and we find out. Then hormone assays, so sometimes we need to do specific hormone test, like as a adrenocorticotropic hormone or thyroid hormone, we check to find out different kind of hormonal disease which can lead to that. There's one specific test hardly done in India, that's we call it trypsin like immunoreactivity, TLI. This is more for this kind of disease like EPI, exocrine pancreatic insufficiency. So these are pancreatic disease which we diagnose and we do for those. And as I was talking about one conditions, I think you have discussed before, inflammatory bowel disease. This is one specific test we do for that, like vitamin B12 or folate we check to kind of diagnose it. And sometimes intestinal biopsy is done to diagnose, because this is sometimes quite a serious problem and which are really very difficult to diagnose. And there's another thing which is left is feline pancreatic lipase. It's a very specific enzyme which is only species specific, like for cats only. This particular enzyme, we call it is lipase, we check and to diagnose whether there's a pancreatitis is there or not. So these are the some kind of diagnostic test which is done. But why I'm kind of bringing it in, because these bringing in your notices, though these are of medical importance, but it is just to bring awareness in you that how basically we need to approach to that. And if you go to veterinarian, you should be knowing about some idea about these kind of tests and investigations to reach to the confirmations of chronic diarrhea. Now this is something which I can kind of just for cat parents. I know that in chronic diarrhea mostly it's a medical path, but something what you can do it actually, and what a pet parent or a cat parent can do it. First thing which is very important, that in young age maximum chronic diarrhea happens either the cat has not been vaccinated properly, like feline parvovirus is there, feline panleukopenia we call it is, or calcivirus, or those can cause it. So if you vaccinate your cat, you can almost prevent these kind of problems and you can save them. Then worm is a very, very important cause, and it has been seen almost 70% kittens, if they're outdoor kittens, they will have worms actually. And if they're having fleas, then indirectly they'll get worms. So taking care of their fleas and their deworming becomes very important, because you can prevent these kind of disease in the initial stage itself. And I think that's a very, very important factor to prevent from the diarrhea or chronic diarrhea to take place. Then early detection of disease. And I probably will act in this way. Maybe I'm thinking as a veterinarian, but if you find a cat is having diarrhea and otherwise cat looks healthy and everything looks fine, and it is always better that try to diagnose as early as possible, because in initial stage you can treat the disease almost like 100%. And when it becomes too chronic, then sometimes even curable disease also becomes incurable. So that's something I will request you, that you try to diagnose this kind of chronic diarrhea as early as possible. Monitor litter box. This is another thing, because many times cat owners hesitate to go to the litter box. They just clean, scoop it, and then they put it. But it is important that you should observe what kind of consistency and how that kind of stools or fecal matter is spreading. It is smelling too much. There is blood in that or not. How is the consistency? How is the how many times your cat is doing, whether it is doing once in a day or whether once in 2 days or once in 3-4 days. So this basically give an idea to you about many kind of conditions, whether it's something alarming situations or not. Then in chronic diarrhea, what happens if the animal it is affecting the metabolism, they start losing weight actually, and sometimes like in hypothyroidism or something, then they start gaining weight. So you need to be careful about that part also, whether they're gaining weight, because these are some common things which a pet parent can do at home itself. Then diet and feeding schedule, you should not do abrupt change of diets. Better you discuss with your veterinarian or some experienced person, and should have a proper diet schedule and maintain it. And always check your cat weight on regular basis, just to ensure that there is no ups and down too much in the cat weight. And water is very important. It has been seen many cats, they don't drink water just like that. So you need to probably develop different method to give them water, like keeping the water bowl at different place. Sometimes they like running water, so you can use tap water or fountains, and those can be used so that they stay hydrated, and these kind of dehydrations or weight loss or nutrition loss doesn't happen even if they have diarrhea. And normally in chronic diarrhea, which we advise, sometimes probiotics or prebiotics giving becomes important. And diet is something which is my request, that I'm sure that you can take care at home level itself. And apart from that, early detection of the disease is extremely important. So these are the some common points which I wanted to share with the all the pet parent or all the cat parents. And with this, I conclude my small presentations on chronic diarrhea in cats. And I will invite, if you have any questions and queries, I'll be happy to answer those.
Thank you, Dr. Pawan. Um,
Thank you. Yeah.
it was a fantastic presentation, and what inference one can conclude is the approach and the preparedness of the cat owner and their reactive nature, how fast they can react, and it will be beneficial for them as well as the cat. So going forward, I have a few questions for you, that from moving forward, to make our cat owners make understand, and also discussing this particular topic. So you've got some good questions. So, how can one conclude that, if it is a viral or bacterial or something based out of nutrition? Like you as said, that taking history is very important. So once the cat owner and the vet collectively have taken the history, so how they can conclude that whether it's a viral, bacterial, or it's something based out of nutrition. So we are not able to hear you. No, still the voice is not there. It's muted, I guess.
Hello, can you hear me now?
Yes, perfectly fine.
Hello.
Yes, we can hear you.
Hello, can you hear me now?
I can hear you. Can you hear me?
Hello, can you hear me, Sakib, now?
I can hear you. Can you hear me? So can you speak something? I'm able to hear. So your thing is muted, I guess. Now it's fine. Can you hear us? Please bear with us. We have a bit of a technical issue, and once we get Dr. Pawan back, we can take your questions discreetly, and we have some good discussion coming up. So kindly post your comments and your questions so that once he's back, he can answer one by one to all of those. And thank you all for patient listening. Just to go ahead with the discussion, Dr. Pawan was saying that management is really important to make your first move as fast as possible, and then you raising an alarm that something is wrong with your cat, and taking an expert advice is always advisable when it comes to diarrhea, and as he suggested, small intestine diarrhea can be more troublesome than large intestine diarrhea, and if you don't act on right time, it can also result into the chronic diarrhea, which is incurable. So I guess we have Dr. Pawan back. Dr. Pawan, can you hear us?
Yes, I can hear you. I'm sorry that I think, don't know whether this StreamYard
Yeah.
has called or internet has.
Sometimes it happens. So yeah, I was asking that you very nicely explained that taking the history is very important, and once a cat owner and a vet they have collected the history, so how can they conclude that whether it's a viral, bacterial, or something which is based out of nutrition in cats?
Okay, so first thing is I'll tell you this. So there are three different things are there, whether it's a viral or it is bacterial or it is nutritional. So to conclude about the viral part being mostly that, so I think the age is, as I mentioned to you, is a very important factor, because mostly viral disease start in the early age, actually, when young. So it is not important during that time that we should focus too much on nutritional, because mostly viral disease will be kind of 80 to 90% cause. So we try to kind of investigate, maybe doing by snap test, or there are some PCR is there, like for example you want to kind of like viral PCR panels are there which you can do it, and you can find out if you want to be specific about which virus is causing, like feline parvovirus, calcivirus, or these kind of things. These has a PCR test, or feline parvovirus or FIP, these has some degree of other like antibody based test also where you can do it. So this is to specifically find out whether which virus is causing. FIP is quite difficult to diagnose, but because 3-4 factors you have to keep in mind: PCR, antibody, IgM, IgG test, and then you conclude that part. Then comes about bacterial part, which is quite if you really want to be specific to diagnose, the fecal culture is only the test which is actually will conclude it. But normally the other symptoms, if animal is having like in bacterial disease, the white blood count will start going high, but in the viral disease, the white blood count will start going down, actually. So this is how your blood test can give you a direction. Okay, you'd go toward the bacterial side or viral side. And nutritional, this is always associated normally with the food chains, like suddenly you have changed some food, or like a different kind of packet you have got it, or you have taken the cat for boarding or something, so then it normally associates. So I think these are the some clues you can get it, and you can take it from there. But I think if it is a young cat, then we will go for the viral disease first. We'll try to rule out those, and if it is a then bacterial, and then nutritional part. This is how we try to diagnose it, actually.
Thank you, sir. And as you discussed about ruling out and going to the root cause of the problem, can you also put some light on what can be a diagnostic tree for chronic diarrhea? Taking this
Okay,
discussion ahead.
so when you're talking about a diagnostic tree, actually, so I think first thing is like for a pet parent or a cat parent, which I'll tell you that. So for example, first thing they should find out whether that cat is, like for example, they should first find a questions whether it's a young or it's a middle age or it's a senior cat. And
Okay.
if in this particular thing, then if their cat is having diarrhea, Then next question they need to ask is whether it is associated with the appetite loss or it is associated with the no appetite loss actually. So, and if the diarrhea is having with the appetite loss or something, then it means it's mostly infectious or something of serious nature. And if it is appetite is good, and otherwise animal is only having diarrhea and he's active on other things, so it means we have to find out some other chronic factor which are more related with the other organs or with the dietary change or those kind of thing. Then comes about is we need to probably the next questions we need to ask in the tree is the small intestinal diarrhea or large intestinal diarrhea actually. So as I mentioned in that part is normally the large intestinal diarrhea will be associated with quite a bit of mucus. So as I say, for a common or layman, I'm telling you, there'll be quite a bit of mucus comes, and animal is otherwise active, playful, eating well. All signs are like a normal cat, but only is diarrhea is there and with quite a bit of mucus. Then it's mostly the large intestinal diarrhea. But animal is slightly showing the sign of weakness, dehydration, and the diarrhea is quite smelly, very like it's spreading quite a bit and very frequent. Then it's mostly the small intestinal diarrhea. So this is how you you go there. Then comes about if there is a history. Then next questions in that you will ask is whether there is any food change you have done or there is no food change you have done, or so then you go to that nutritional cause you try to rule out from there. The next question goes is vaccinated properly or not vaccinated properly. So then basically the next, so if it is not vaccinated, then your infectious cause becomes like important. Then comes about at the same time it is an outdoor cat or indoor cat or outdoor indoor cat, because chances of outdoor cat parasite intestines, those becomes important. So like these factors you have to just keep matching it, like which other factors are kind of coming, then you definitely you need a help of veterinarian to diagnose in this part. But it can definitely give you, if you just follow these some yes or no instructions, whether outdoor, indoor, young, adult or senior, or any dietary change, no dietary change, then you'll be able to come to a kind of conclusion that which are the factors which you have to focus more actually, that part. So that's something I can kind of suggest you, like in a quick view for the diagnostic tree, if you can thinking about chronic diarrhea.
Thank you, sir. So, I can just repeat these things, what you said for cat owners, because it's very important not to conclude. And as you rightly mentioned, not to go for generic medication, because, cat owners become impatient, and there is a lot of panic, and without going to the root cause, there will be some broad spectrum treatment, which is not desirable. So what Dr. Pawan suggests here is like, one should go for the age, whether the cat is a kitten, a middle-aged cat, or an old-age cat, then to see whether it's a small intestine or large intestine diarrhea. Then maybe say a food change, immediate food change, vaccination history, and also whether it's an indoor outdoor cat. So I think this kind of history will give also a very good heads up for a veterinarian to analyze a problem.
Absolutely.
Great, sir. And going forward, one beautiful thing you mentioned, that in large intestine, it will be more of mucus, and it will be loose stool, but the cat will be happy. It will be playful, and there will not be a lot of behavioral change. So it's always said that your stool is the mirror of your health. So how can one
Absolutely.
how can one conclude from whether if it is a black stool or a white stool or stool with blood, or a stool with mucus? So how can one conclude that what can be the real cause of this, just looking into the condition of the stool?
Okay, so I think when we talk about so I think you're talking about two things, like consistency and color of fecal matter, means
That's
how
right.
it can give. So it's not like a confirmatory diagnosis, but it definitely gives us some clues to reach to the diagnosis. For example, like a stool is there which has, as I mentioned to you, that so for example, animal is passing stools very frequently, like you doing almost some 5-6 times a day actually, and it is very like it's a quite a watery, it's smelling, there is a quite a bit of flatulence is there in that. So this indirectly happens with more of viral disease, which is associated with the secondary bacterial infection, because those bacteria produce quite a bit of endotoxins, and it gives an indirect indications about their part. So this becomes more of small bowel diarrhea. As I told you about the mucus part, if the mucus is there, then it is more related with the large intestine, like colon and rectum. Then another thing is the blood color. Like, for example, there is a diarrhea, but it is more of black color actually. Then it gives you indication that somewhere bleeding is happening in stomach or in the small intestine, like initial portion of intestine, like in the stomach or in the duodenum part. Because by the time it will pass through the whole tract, it will get digested and it becomes black in color. Then if you find it's a more of like a chocolate color and with quite a bit of watery diarrhea, then it is more any part of small intestine like jejunum or cecum, the bleeding is happening. Then it gives indication that the bleeding is or infection is in that area. If you find that there is a mucus, there is a diarrhea, but it is having with the fresh bleeding or like a frank blood is coming, then it's indirect indication that it is in the large intestine like rectum or in the colon. So this is how it can give a kind of direction where it is the diarrhea is basically getting started. So, and depending upon the area, then you have to investigate what are the factors in that area can cause it, and then you approach to the actual diagnosis. As I rightly said that stool is a mirror of health, and that's something is very important a pet owner should be aware about.
Yeah. So moving forward, is there any problem because in homes with multiple cats, can this viral infection, as you said, that cats are more prone to viral infection. Even the kittens, you would say that you will direct yourself towards the viral infections. So is it transmittable from one kitten to another kitten or from one cat to another cat? And one should one quarantine this particular cat and isolate them till it is treated?
Yeah, so when we think about the viral infection, yes, most of the viral infection which cause diarrhea, these all are transmissible, like from one kittens to another kitten it can go. And you might have seen that once like one mother had delivered the kittens, or so almost one kitten got parvovirus, and then after that almost all got the parvovirus actually there. So
Okay.
that feline parvovirus which I'm talking, so this is definitely highly transmissible and it's highly infectious. Same thing applies to the calcivirus. Then we're talking about the FIP, which is feline like infectious peritonitis, that is also infectious by secretions and other blood methods and other things actually. So most of these viral disease are infectious actually, that except very few which are get transmitted by blood or those kind of thing. But yes, most of them are highly infectious. Now comes about when you diagnose, like for example, one cat has been diagnosed with the diarrhea and you diagnose with the, for example, with the FIP or with the FPV, like feline leukopenia virus or parvovirus, which we talk about. So once you diagnose it, it is first thing is very important that you isolate from all the cats or with the youngs as soon as possible. The person there, his litter box with his whatever fomites or means clothing or anything you're using, it should be separated because virus stays for really long time. And this virus, particularly like I'm talking about the feline parvovirus, it's a very resistant virus. So you probably really you need to kind of do the disinfections all those method as fast and as frequently possible, because it's quite difficult to kill this virus. Isolation is very important. At the same time, the people who are handling, I probably will kind of advise that the people should be separate. Like for example, they're handling this kind of infectious virus, and then they should not handle those young kittens particularly. Better other family members deal with them, or better they are having in this kind of hospital who has a isolation or infectious ward where they can isolate and keep them actually there, because they should be separately treated actually. So this is very, very important, that isolation is one very essential and a primary step. Like you have heard in human coronavirus, I think, why the quarantine has come, because that's only the reason. It's same thing applies with the viral disease in cats as well.
Right. And would you like to comment that does this kind of virus or has some zoonotic importance?
Okay, so many virus which are to the cat, those are like not causing the issues. But like for example, when we talk about like as I mentioned to you about like one of them is giardiasis is there, then leptospirosis. So these are not, the giardiasis is one parasitic disease, leptospira is one bacterial disease. These can cause, apart from from cat, the common disease which we can get is only the rabies. Like in dogs, you heard about distemper virus, which comes canine distemper. But that disease Very rarely in human it can cause like conjunctivitis or those kind of signs, but mostly these are not zoonotic, except like the very few virus which can lead to. But normally those we don't encounter in the common practice, so they don't need to worry unless until it is specifically diagnosed actually. And then yes, chlamydiasis or those kind of things which we need to kind of find out. That is mostly happens more with the birds actually. That yeah.
Right. So, thanks a lot, Dr. Pawan. Moving forward, I have one more question that, how important is the role of prebiotics and postbiotics and probiotics in management of diarrhea?
Okay, so first thing is like when we are talking about the prebiotics or probiotics, so these are basically supplements. These are not the main treatment, but yeah, these are like, for example, a person is having anemia and you are doing a blood transfusion to him. So blood transfusion is not a treatment. You need to
Right.
treat the main cause why the blood loss has happened actually, but temporarily to support him till animal uh, come out of that situation. So you are giving some support system. And why the probiotics and prebiotics becomes very important during this time, because most of the diarrhea, like chronic diarrhea which happens, so there what happens, the digestibility, the assimilation power of, and the bacteria which are beneficial bacteria for us, this all goes down in diarrhea. So what happens,
Okay.
all get flushed out actually. So we are giving artificially, we are trying to bring the natural environment by giving these prebiotics or probiotics. So these plays a very important supportive role, though it's not the primary role. But I think the recommended dose in any kind of diarrhea, it is always recommended that it's always a good support. And I probably will prefer even the in cat, the requirement of B complex is almost 6 to 7 times more than dogs actually when you calculate properly. So B
Right.
complex is also equally very important in cats, because in diarrhea particularly, because they lose quite a bit of bacteria which actually helps to give the like production of these vitamins, like particularly the B complex. So when the diarrhea is there, those vitamins are not there. Indirectly we and cat deprived of those B complex, and you find hepatic lipidosis and all those kind of conditions start developing. So it is quite important that you should give them B complex as well. So I think prebiotics and probiotics are a supportive management, but yes, it's an important management actually. But always should be given a recommended dose, not like anything you just start from anywhere actually. That
That's right. That's right. So, thank you, Dr. Pawan. We have some questions written by our viewers. So, here is Mohammed Zain. He asked that how do I select food for cats with chronic diarrhea? Any recommendations on home food too?
okay, so first thing is I think the question, this is like a kind of generic question he's given me, is how to select food for a cat. First thing is we don't know whether the food is actually factor for the diarrhea or not, because we need to primarily diagnose why your cat is having diarrhea actually. So my emphasis probably will be, there is probably try to diagnose why that diarrhea is there, whether it's related with what is the cause, whether it's a senior cat, junior cat, or so I think the primarily your focus should be to diagnose why the diarrhea is there. Then comes about in diarrhea what kind of food to be given, that I can probably suggest to you. Means what kind of food in diarrhea we advise. So any food which is low fat food, which is high fiber food, easily digestible protein, novel proteins are there. Those like now many companies which are making research based food actually, like these gastrointestinal diet or those intestinal diet or those. So I think some companies makes quite decent food like of those which are very helpful for these kind of conditions. Apart from that, if you are giving a home food, then I probably will prefer that any food which has a low fat, that becomes the primary requirement, because in diarrhea fat is something which is very difficult to digest. And but protein, any protein which is easily digestible protein, like fish protein or egg protein, these are easily digestible protein which can be used. And otherwise, as for the carbohydrate for cat, as I mentioned, the cat need comparatively much carbohydrate than even human or dogs. So carbohydrate, any things can be used, whether it's a rice or maybe better is boiled potato, and those kind of thing can be used. But I think the egg becomes the very important part, which I will probably advise you as a source of protein, and the fish is second, then chicken, then your other things, whatever you like to do that part. So here primary cause diagnosis is more important than what the diet to be given. And fiber is very, very important in diarrhea.
Yeah. Thank you, doctor. Mr. Abhishek asked that 45 days old kitten having chronic diarrhea. Can you please guide to handle this situation?
Okay, so first thing, I think he's a 45 days kitten, and if he's otherwise, I think he's didn't mention anything else, whether he's eating, not eating, but I assume that he's eating active and he's having only diarrhea. So
Right.
then mostly it is worm related actually. And he should first do a simple fecal test, which is quite easy to do that. Mostly this kitten is having worms, and my request would be there is uh, kind of first focus if you can diagnose the worm. Second thing, if Mr. Abhishek is giving milk, and because many cats they can't really tolerate too well that milk part, so I'll probably request that if he's giving milk, then first thing he should stop that actually. So that is another thing which I'll advise. So I think it could be diet related also, that you are giving too much of milk, but he doesn't need that actually. You should go for animal protein, in my opinion, which can be fish, egg, or any ready-made these foods are there. So right now I can only advise there are some specific food which are meant for gastrointestinal disease, like these are wet food, come GI food, or those. For some time you can switch on to those food, or hypoallergenic food can be another advice. And probiotics, as we had discussed, a minimal amount of probiotics can be added. If you have an access to a veterinarian, better do the fecal test to diagnose if there are worms. But otherwise also it is no harm doing a proper dose of deworming now and repeat after 3 weeks again, because if sometime there are worms, so adult worm will die now, and then again some larva or those will becomes again adult after 2-3 weeks, then again you will do the deworming, so everything will be eradicated. And yeah, if it is associated with the not eating and vomiting, another thing, then I think it's a serious thing, then you should approach to the doctor and diagnose for viral disease. So this will be my advice to you.
In continuity to what you were speaking, we have one more question. Um, is Pooja? Yeah. So Pooja asked that is deworming plays important role in avoiding such situation.
Yeah, as I think in presentation which I have mentioned that so many times the diarrhea is caused because of parasite. So I think deworming is a preventive procedure, because we know that definitely the worms will come in young kittens if they are outdoor and indoor kind of thing. So if you do the deworming, of course the worms will not come, and you'll prevent the diarrhea and these kind of issues. And it is very very important to do the deworming. It plays a very important role in chronic diarrhea or diarrhea, these kind of situations. So it is absolutely very important to think about vaccinations and deworming.
Okay. And one question from my side, Dr. Pawan, is like, do you do fecal transfusion in diarrhea?
Yeah, sometime we have done, and we do that part as well. So that is basically yes, because there are lots of kind of actual bacteria what you need, even that has probiotics also in that. So you can use the fecal, kind of it can be used. Yes, it's been used. There are some papers has been published for using this part. So yes, it can be, but we used very rarely, not in a common practice we use. One thing is it's not been liked by the uh, it's not liked by the owners. And second thing is, but if you think about dogs or rabbits, you might have heard about, because they are coprophasic by nature actually, because dogs can eat their own poop actually. That so, and rabbit, if you think by nature, they eat their own poop and they recycle it. So the purpose is to they are recycling the nutritional value, and they're trying to get it actually again. But yes, in diarrhea, because the main purpose here is to get the probiotics and kind of the normal microflora which need to be there in the intestine, you are getting that back. So for that, it can be used, not very well established in the practice. But the same questions, I think this is one thing which probably brings me to another one questions, maggot therapy actually. Many
Okay.
times there are wounds are there, and people always worry about maggots. Maggot means these worms which comes in the wound. But there are many time cases we have treated, and cancer we have treated with the maggots. Actually we put maggots in the those kind of wounds, and then the maggots eats up that wound, and it actually make a really very fresh wound, and which heals very fast. So these are something which is very uncommon practice, but yes, it can be practiced and it can be used. But yes, scientifically these are possible.
Okay. I think there is a doctor who's asking a question if you want to take it, or it's Anup Goyal, dose of prednisolone for colitis in cats?
Okay, so I think he has written colitis, but whether it is immune-mediated colitis or it is colitis caused because of worms. If it is caused because of worms, I'll advise not to use prednisolone. But if it is, he's suspecting it is that is plasmocytic colitis, or it is immune-related, or like ulcerative colitis, which is caused because of immune-mediated conditions, then my advice will be there. The prednisolone can be used. My advice always in before starting prednisolone that first you rule out other factors, because actually prednisolone, if you give in normal animal, it causes diarrhea. You getting what I'm saying? That because in normal animal and normal cat, if you give prednisolone, because one side effect of prednisolone, it can cause diarrhea or vomiting. But in immune-mediated conditions, prednisolone can actually heal the diarrhea. That's why in inflammatory bowel disease or in ulcerative colitis or immune-mediated colitis, we give prednisolone as a treatment. And the dose goes 0.5 milligram to 1 milligram per kg body weight. But I always start with the 1 mg per kg body weight, and then start tapering it down depending upon the severity of conditions. But dose rate is 0.5 mg to 1 mg per kg body weight. This is what we use and we advise regularly. It depends upon the severity of that, but you can use normally in actual conditions we use 1 mg per kg body weight.
Great, sir. You also mentioned that, I was looking for a question, but I somehow lost it. There was a question that, what is the importance of vaccination in this situation? As you rightly told that, they are more subjective to viral infection. Is it only to eliminate the viral cause, or does it have some other importance also, the vaccination?
Okay, so when we talk about vaccine, so vaccine is it's a passive kind of immunity which we get it. So it's an indirect immunity we are getting it. But mostly the vaccines, like in cat, when we are talking in particular, these mostly are for viruses actually. And this is what is basically like so far whatever vaccines are available for cats, mostly for viruses are there, though leptospira vaccines and other things are available, but and in cats it's not there really actually there. But when we talk about it is only to improve one kind of immunity. So like first dose of vaccine when we give, so then it basically induce one immunity. We call it is like it's like a broad immunity. Only IgM, one particular kind of antibody, come with that. And when you again revaccinate or you do the booster, then one IgG, one antibody comes in the system, and then you again revaccinate. So those specific IgG becomes more actually, and those IgG means that is immunoglobulin G, we call it is. So those are the antibodies which need to stay in the longer time, and that brings the memory cell, and those memory cells stays for longer time. And but yeah, it is only has the only effect of vaccination is to get the immunity and to prevent the any kind of infection which comes into the system, but it doesn't have any other effect. And it doesn't mean that's also for the pet parent and cat parent, it becomes very important that you given the vaccine, it doesn't mean that you 100% prevented that cat from the disease, because every vaccine has 80%, 85% specificity or sensitivity. It is never 100%. Even rabies vaccine doesn't have rabies means 100% that you can safeguard. That's why prevention still is very important. So this is something I can kind of comment on that part.
Thank you, sir, and thanks a lot for guiding us through. And what I can say, one-liner takeaway is the approach that is important in managing diarrhea, whether it's prevention or it's the treatment that you're going through, and have patience. So, sir, any one-liner takeaway that you would like to guide our cat owners in any sort of situation like this?
Okay, so I think my probably one simple and very important concluding will be there. Early detection of disease is very important. If you act early, this applies to any condition. Though, if you can, you should know your cat normal and abnormal finding. You should observe your cat on a regular basis. What is normal and what is abnormal, and if you detect it in early, then you can almost treat even the cancer which I'm talking about, which is we call about it's incurable. Even if you diagnose a cancer in early stage, you almost can cure it. And it has been seen by many practitioners, and of course we, and I'm sure many practitioners which you're encountering, if you diagnose a disease in early is, it's almost curable. Same thing applies with the human corona. Same thing applies with the cancers and everything, actually. If you diagnose early, so early detection should be your, I think, one take-home message, and which I will kind of emphasize on that.
Great. Thank you, doctor. And sometimes it's challenging, if I'm talking from the perspective of a cat owner, cats, they hide their problems and their diseases. So it's
Very
pretty
good.
tough for them. So you have to be more vigilant, more attentive to what your cat is doing, how it is eating, how it is drinking, how's the poop, and all the basic behavioral aspect that you can see and grab. Because in
Yeah.
multiple cat homes, it's very tough to get a grip on this situation. But I'm sure that 100% that this seminar would be very helpful to our cat owners. And thank you for taking out time for us. Again, on behalf of Feline Club of India and whole cat fraternity, I would like to thank you for investing your time here with
Thank you
us.
so much, and thank you so much for giving me an opportunity. It is love to speak, and I'm sure if I hope that this whatever piece of information was helpful to them. Otherwise, they can approach me anytime, whenever required. Thank you.
Right, sir. Right, sir. Thanks a lot.